Did you know that you can keep your heart safe with just one easy habit? Reduce blood pressure and improve your quality of sleep. Simultaneously, there is something that you can do from the comfort of your living room at a time when our energy levels aren't quite what they once were and every visit to the doctor appears to involve more medication and additional cautions. It doesn't require a gym, pricey equipment, or even leaving the house. If you're between the ages of 55 and 80, you've probably already begun to notice how your body responds differently to stress, diet, and especially movement. In fact, it might be the most natural remedy your doctor never informed you about. Your blood pressure may not return to normal as it once did, and you may even start to worry about your heart or experience insomnia. Here's the good news, though. This need not be the case. Older folks can engage in safe, easy workouts to maintain a healthy heart, lower blood pressure naturally, and even fend off more serious issues like heart attacks. This video is not about overtaxing your body. It involves moving in the appropriate manner at the appropriate pace for your stage of life. I'll also take you through 5 effective, doctor-approved exercises that thousands of seniors use to maintain their strength, stability, and protection. Thus, find a cozy chair, make sure you have some room around you, and remain with me through to the very finish. Regardless of age, you may be shocked to learn how much influence you truly have over your heart health. Let's begin. Take one brisk walk as exercise. Although it may seem easy, brisk walking is one of the best ways to lower blood pressure and protect your heart for those in their 60s, 70s, and beyond. The rhythm holds the key. Walking at a rate that causes your heart to beat a bit quicker without making you gasp for air gives your cardiovascular system the little boost it needs to remain robust. And this is what's amazing. According to studies, walking briskly for just 30 minutes each day can gradually reduce systolic blood pressure by up to 10 points. That is a significant difference. Such a shift could result in fewer prescription drugs, fewer trips to the doctor, and much greater freedom. Walking also reduces psychological stress, which is frequently an imperceptible factor in heart strain. Walking outside, whether in a park or your neighborhood, not only helps you move your legs but also relaxes your thoughts. Most people don't realize this, but walking with a spouse, neighbor, or even a dog lowers the type of chronic stress that keeps your blood pressure elevated even when your body is at rest. It reduces blood pressure even more by fostering social connection. The weight of loneliness is heavy. Moving with a firm eases the burden in a number of ways. A 78-year-old viewer named Harold from Minnesota wrote to let us know that he began going for a daily walk after breakfast. He admitted that it was initially difficult to get started. He didn't think it would help his aching legs, but after only 2 weeks he realized that he wasn't feeling as heavy when standing, and his doctor informed him that his numbers were already getting better. Consistency accomplishes that. Walking daily is more important than walking far. Even after a brief period of time, the outcomes speak for themselves. One of the most accessible and underappreciated tools in your health toolkit is brisk walking, or genuine purposeful walking. When you think of exercise after the age of 70, it's easy to picture treadmills or complicated devices that feel more like punishment than assistance. It doesn't require any training, equipment, or gym membership. All you need is a pair of shoes and the will to start. Perform 2 chair squat exercises. Chair squats may seem insignificant, but they activate your legs and glutes, the largest muscles in your body, which directly affects your heart. This is because your leg muscles function as a second heart. Better circulation results from their assistance in pushing blood back up to your chest when they are robust and functioning properly, which lessens the strain on your heart. Lower blood pressure and a decreased chance of blood clotting or pooling in the legs, which can occur more frequently as we age and walk less. You don't need to do anything special. Simply getting out of a chair and sitting back down slowly and deliberately works your hips, thighs, and core. That exercise improves vascular tone, or how well your blood vessels expand and contract, and helps control blood sugar in addition to strengthening your muscles. Your heart won't have to work as hard if your veins remain flexible, which is crucial for preventing hypertension and heart strain in later age. From a psychological perspective, chair squats also help people feel more confident. Every time you rise up from a chair by yourself without using your arms or leaning, you're teaching your body and brain that you're still competent, and that kind of self-belief has genuine health benefits. Many seniors silently harbor a fear of falling or of not being able to get up once they're down. People continue to be active when they feel capable. They maintain their independence while they are active. Martha, an 82-year-old viewer from Oregon, told us that it was difficult at first to begin with just 5 chair squats every day. She first required assistance after her knees popped, but after 3 weeks she was able to perform 10 without using her hands. Even better, her doctor reported that her resting heart rate had decreased and she felt more stable when walking. That's not luck, rather, it's strength being restored one sit and stand at a time. Please let me know in the second remark below if you're still watching this video and finding these ideas helpful. Additionally, I advise you to turn on the bell and subscribe if you haven't already so you don't miss any videos. Your assistance enables us to keep producing quality content that will educate and uplift you. Let's proceed now. Perform 3 push-ups against the wall. Wall push-ups are frequently disregarded because they appear too simple, but that's precisely why they're ideal, particularly for senior citizens who wish to strengthen their hearts without straining their joints. The secret isn't in how hard they are. It's in what they activate. Your chest, arms, shoulders, and upper back are used as you push your body away from a wall. More significantly, though, you improve circulation and blood flow to your heart and other upper body parts. Consider it this way. Your arteries become more responsive each time you apply pressure to the wall. The repetitive action enhances vascular elasticity, which helps minimize spikes in blood pressure. Additionally, that lowers your chance of having a heart attack over time, particularly the kind that strikes unexpectedly in your 70s or 80s. According to studies, performing light resistance exercises like this for even 10 minutes each day will help control your systolic pressure. Another advantage of wall push-ups is that they help refresh your mind. Your posture naturally improves when you stand erect, face forward, and press against resistance, which opens up your chest cavity and permits deeper breathing. More energy and less stress are associated with improved oxygen flow. 2 important yet underappreciated factors that contribute to cardiovascular health, and let's face it, having good posture feels wonderful. Reminding your body that you are still strong and upright rather than contracting or collapsing into yourself is anchoring. A 74-year-old man named Leonard informed me that his balance had improved after he began performing wall push-ups while brushing his teeth merely 10 times a day. Today, he performs 30 while watching the news. Leonard had a triple bypass 10 years prior. When his blood pressure medication was lowered, he at last began to sleep better at night. That is what simple consistency looks like. Just one wall and the choice to use it, not a gym with expensive equipment. Your body is telling you, I still want to work. Give me a chance, please. Additionally, one of the most modest yet effective invitations you can provide is a wall push-up. Perform 4 leg raises. Leg raises have a subtly potent effect. Although they only involve raising one leg at a time while sitting or lying down, they are actually strengthening some of the most vital systems in your body that maintain a healthy heart and stable blood pressure. This is because the greatest muscles in your body are found in your legs, and when they contract, they gently push blood back to the heart. Since most of us spend more time sitting than we used to after the age of 70, this motion is especially beneficial for those who sit a lot or have poor circulation in the lower half of their bodies. However, blood that sits in the legs for an extended period of time can cause swelling, exhaustion, and eventually even elevated blood pressure. One thing I love about leg raises is how simple they are to incorporate into your day. You can perform them while watching TV, waiting for the kettle to boil, or even sitting on the edge of your bed before bed. Leg raises also help prevent that by reviving your calves, thighs, and even your glutes, which are big muscle groups that subtly support your cardiovascular system throughout the day. Simply elevate one leg slowly, hold it there for a few seconds, and then carefully drop it. Switch up your legs and breathe through it. That is a crucial aspect. Maintaining a consistent breathing pattern while moving your limbs signals to your nervous system that everything is fine, which lowers internal strain both physically and emotionally. Additionally, there is a significant psychological advantage. Regularly performing leg lifts helps elderly persons feel more in charge of their health. Ethel, 81, a woman I met, told me she hadn't been comfortable walking to the shop in years, but after 3 weeks of practicing leg raises every day, she realized she wasn't holding on to the handrails as firmly, and her gait got stronger. She also mentioned something that really resonated with me. I no longer felt weak. That emotion is more important than we frequently think. Therefore, I want you to keep in mind what's actually happening, even if you believe it's just elevating my legs. You're laying the groundwork for long-term independence, circulation, blood pressure, and mobility. If you're still watching this video and finding these insights useful, please let me know by leaving a comment below number 4. And to ensure you don't miss any videos, I advise you to subscribe and turn on the bell if you haven't already. Your assistance enables us to keep producing quality content that will educate and uplift you. Let's go ahead now. Perform 5 wall push-ups. Wall push-ups may seem too easy to be effective, but for senior citizens, they provide the ideal mix of safety and strength training. Unlike conventional floor push-ups, wall push-ups provide your upper body the movement it vitally needs to remain strong and heart healthy while also relieving the strain on your wrists, shoulders, and lower back. Why is that important? Because your arms, shoulders, and chest have a greater impact on heart health than you may realize. By using those muscles, you're promoting easier blood flow and more effective oxygen movement throughout your body, which lowers blood pressure and makes it easier for your heart to beat. This type of resistance training is mild but steady, and aging hearts react favorably to it. Here's how to do it. Place yourself at arm's length from a wall. Your hands should be shoulder-width apart and flat against it. Lean your chest against the wall and slowly bend your elbows before pushing yourself back out. You don't have to go quickly. Slower is preferable. Controlled motions build muscle without putting undue strain on your joints. And here's a tip I provide to those who lack motivation. Do them as you wait for your tea to simmer or while you brush your teeth. Performing 5 to 10 wall push-ups a few times a day can improve your breathing, endurance, and confidence. Harold, 74, once told me something that I will never forget. I started with wall push-ups thinking it was nothing, but now I can take deeper breaths, and I don't feel like my chest is closing in anymore. That's not magic, that's muscle and oxygen and circulation working the way they should. And let's not forget the emotional part. When you can push yourself even gently, you start believing you still have strength left in you, and that belief spills over into everything from how you get out of bed to how you speak to how you live. So if your arms have been feeling weak or if you've been feeling like you're slowly shrinking into your chair, I want you to remember that every wall push-up you perform is your fight back, not just against weakness, but against the notion that aging must mean decline. Because if you keep going, it doesn't. Vinyl-related ideas. These 5 exercises may seem easy at first, but don't let that fool you. They all support your heart, blood pressure, and general energy more than you may realize, and none of them call for a fancy gym or a lot of time. Growing older doesn't mean giving up on your heart or your health. On the contrary, it's time to protect the body that has supported you through so much. Just your breathing, your body, and your readiness to attempt consistency is the most important factor. Your body remembers and rewards you when you take one stroll, one stretch, and one exercise at a time. You benefit from having more stable blood pressure, a more relaxed heart and mind that don't need to work extra hours to get you through the day. So I have a question for you. Which of these are you willing to begin today, and how many of these are you currently doing? Give it some thought, then share your thoughts in the comments section. We appreciate you being here today, and we look forward to hearing from you. Let's support one another, grow stronger, and learn from one another. We value your opinions, so please feel free to express them in the comments section below. Tell us one thing you learned today and how you intend to apply it in your life. Reading your remarks greatly inspires and motivates us. Please like, subscribe, and share this video if you found it entertaining and useful. We appreciate your support in helping us to keep producing quality content that will educate and uplift you. We hope to see you in the future video.